welcome back. You're watching Health and Wellness Save a Life. Every life is invaluable and precious, and when medical emergencies like a cardiac arrest happen around a person, it's important to be prepared. You can help someone in a medical emergency only when you're clear as to what needs to be done in that situation. So if you are aware and informed, then you can take steps to revive a person and save his life. Worldwide, millions of people die of sudden cardiac arrest every year. Now, this is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation or CPR. Many adults in cardiac arrest can be revived with intact neurological function if the bystander or the people around them can provide immediate CPR. Raising public awareness and understanding of practical applications of CPR is therefore an essential strategy to increase CPR success in cardiac arrest cases. It's even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who will help you understand sudden cardiac death and the role of CPR to revive and save a life. Dr. Hariom Tyagi, interventional cardiologist, Lokpriya Hospital, Meerut, is with us. Dr. Kamal Kishore, interventional cardiologist, Rama Super Speciality and Critical Care Hospital, Karnal, is also with us. We also have Dr. Swapnil Pathak, interventional cardiologist, Adya Cardiac Care, Lucknow. Thank you, doctors, very much for joining us. Dr. Tyagi, is it true that Indians are more prone to heart disease? If so, why?
Yeah, good afternoon. So we can say it like that Indians have a greater genetic predisposition to the heart disease. That's due to the acute myocardial infarction in South Asians occur at around 10 years earlier than the Western population. Indians have significantly higher population attributable risk as associated with waist-hip ratio and the abnormal lipid profile, smoking, hypertension, diabetes, abdominal obesity particularly, and psychosocial factors, diet plan, unhealthy diet plans, alcohol, and physical inactivities. And out of these, the two most important parts which are more predisposing to the South Asian Indians and particularly to the Asian population is the abdominal obesity and genetic predisposition with physical inactivity. So these are the more prone to develop the heart disease at around 10 years earlier than in the counterpart with the Western population.
Right, Dr. Kishore, what happens if you have an abnormal heart rhythm, and what is the most common heart rhythm abnormality?
So the abnormal heartbeat may affect a person in many ways, and patient presentation depends upon these abnormalities' nature. For example, if the heartbeat is slow, then the brain does not receive sufficient blood, and in that cases, patient may come with a feeling of giddiness, palpitations, history of fall, or that may lead to fracture and head injury sometime. On the other hand, the patient may have an episode of abnormally high and irregularly heartbeat, what we call as atrial fibrillations, in which there is an inefficient pumping of a particular chamber of heart, and that lead to stagnation of blood and ultimately clot formations. So sooner or later these clot break down and these migrate to different body parts, different body organs, and this presentation here depends upon the involvement of the body organ. For example, if brain is involved, that may lead to stroke, and if foot is involved, that may lead to gangrenes. So in a nutshell, the presentation varies from simple palpitation, giddiness, fall, and to the fatal stroke.
Dr. Pathak, are there any symptoms that allow one to know if there is something wrong with the heart rhythm?
Yeah, so thank you for the question. As we all know, the sudden cardiac arrest, where the CPR is usually performed, is a sudden event. But yes, there are some warning signs which, if not ignored, will be very helpful in preventing such events. Some of the very important warning signs that the patient may get are basically chest pain or any discomfort in chest, like chest heaviness, or the patient may feel shortness of breath, extreme weakness, dizziness, sweating. These are the you may have your heartbeat pounding very rapidly, or there may be irregularity in your heartbeat. So these are the basic signs which are there before a person experiences cardiac arrest, and one should be aware of these symptoms and signs, and more so if the patient is suffering from any cardiac disease or risk factors for heart disease, like patient is having diabetes or hypertension, then these symptoms become more ominous, and if properly evaluated and properly intervened, may prevent the sudden cardiac arrests.
Right, Dr. Tyagi, cardiac arrest and heart attack are now commonly seen in younger people as well. Can CPR help to reduce the fatality rate, and what exactly is CPR, if you could break it down for the benefit of our viewers?
Yeah, thank you. So we can say the cardiac arrest and heart attack are two different entities, but heart attack, particularly in Indians in the age of 20 to 40 years, initially the age group is after the 40 years, we can say this is the age group for the heart attack to develop. And before the 40 to 40 years of the age, we can say that the premature heart attack or premature coronary artery disease. But the scenario is changed in last 2 decades because the propensity to develop the heart attack in between the 20 to 40 years is globally increased, and particularly for the Indians, it's considered around 15 to 16% of the total population of the heart attack are in between the 20 to 40 years of the age. The main cause to develop the heart attack in the younger age, one is the genetic predisposition, and second part is the smoking. So these are the out of the other risk factor, these are the two most important part which are predisposing to the acute heart attack in the younger population, along with the smoking and inactivity, dyslipidemia and obesity. So currently, regarding the cardiac arrest, we can say the out of 10, only the 9, one person can survive after the cardiac arrest. 9 out of 10 who have cardiac arrest outside the hospital die, but the CPR is the only parameter that can improve those odds and save the life of the patient. So during cardiac arrest, we can say the heart cannot pump blood to the rest of the vital organs like the brain and the lungs. These are the two vital organs who are needed to survive the patients. The role of the CPR in this case is to pump the blood and to sufficiently supply the brain and the vital organs so that blood flowing to these vital organs and other part of the body. So that can happen in minutes without treatment. So if we start CPR before taking the other measures like cardioversion or defibrillation, the CPR is the only mean to pump the blood or survive the brain and the lungs part, vital organs. In between, we can give this DC shock or cardioversion to the patient.
Right, Dr. Kishore, does CPR apply in both conditions like cardiac arrest and heart attack?
No, basically we need to understand the cardiac arrest and heart attack are the two different entities. So heart attack is happens when there is a sudden interruption in the supply of oxygen-rich blood to a particular section of the heart. But since heart receives blood from the multiple vessels, so there is only mild derangement in pumping of heart during heart attack, unless there is a massive blockages in the heart. So primary treatment here is just to open and restore the blood to the particular section of the heart, so that the future damage to the heart muscles can be prevented. Cardiac arrest, on the other hand, means there is an abrupt and complete loss of pumping activity of the heart. So it may be because of heart attack, it may be because of abnormal high heart rate, and there are thousands of reasons. The important thing is there is a complete loss of pumping power and vital organs, as Dr. Tyagi has said, the vital organs, they stop receiving oxygenated blood, and within seconds, patient loses consciousness, and within minutes, there is a permanent damage to brain and may ultimately lead to death if not being intervened. So, chest compression, that is a part of CPR, primarily is for cardiac arrest, and it is not for the heart attack patients.
Right. Dr. Pathak, which is the correct first step when you're at a scene where a person is collapsed? What should you be doing?
Yeah. So as soon as you witness somebody who has collapsed, the first and foremost thing is to understand what are the surroundings. Is the environment safe or not? You don't want to be doing a CPR in the middle of a road. So if the environment is safe, then you first have to check whether the person is conscious or unconscious. If the person is conscious, good enough, transfer him to a hospital or a primary care facility nearby. If you seem that the patient is unconscious, then you need to shake him rigorously and call out loud whether he is okay or not. If the person is not responding, then you can safely assume that the patient has experienced cardiac arrest, and then you can start the CPR. If you are a trained person, you can check the pulse, and if the pulse is not coming for at least 10 seconds, that is also an indication for starting CPR. For untrained people, you can start with the hands-on CPR. You do not need to give the mouth-to-mouth aspiration. You can start with the hands-on CPR, and and always before starting a CPR procedure, call out for help to nearby people so that they can contact the nearby authorities, because ultimately the patient, the survivor or the person has to be transported to a medical facility.
All right, those are important clarifications being issued by the doctors. We're going to slip into a very short break on that note, but we have a lot more questions on the other side. Stay with us. Welcome back. You're watching Health and Wellness Save a Life. Our panel of expert doctors continues to be live with us. Dr. Tyagi, will chest compressions alone bring the person back or restart the heart? And what is the correct way to give chest compressions?
Yeah. The idea of cardiopulmonary resuscitation or CPR is not to restart the heart beating again. The only purpose to give the CPR is to get the oxygen into the person's lung to prevent the brain damage. So after the cardiac arrest, the meaning of the cardiac arrest means if the heartbeat go very high or very low. If the patient develop ventricular tachycardia or ventricular fibrillation, or maybe a complete heart block with heart rate less than 20 beats per minute, in these two cases, the heart is not properly able to supply the blood or oxygen to the vital organs like lungs and brain, particularly the brain. Brains have no storehouse, so we can get the blood or oxygen directly from the blood. So if the supply to the oxygen or nutrient to the brain is not is delayed for more than 20 to 30 seconds, then the damage start in the brain. So in that period, we should give the CPR or cardiopulmonary resuscitation that involves the pressing the hard and fast in the center of the chest and with the heel of your hand. Give the chest compression at least around 5 to 6 centimeter deep, yani around 2 inches at the rate of the 100 to 120 per minute. So let the chest come back to the normal position after the each compression or each push, and then continue giving CPR until the medical professional team arrived and we can give the defibrillation or we can get this heart rate after this external pacing effect. Thank you.
Right. Dr. Kishore, what are some of the complications that are associated with chest compression?
So, the immediate initiation of chest compression in victim of sudden cardiac arrest may resume the pump activity of the heart. But if not done properly, if not done efficiently, or if done at the wrong side, for example, say at very higher side or very lower side, then it may also invite some unwanted complications. For example, if you are doing a CPR, if you are doing chest compression very hard, especially in the older age when the bony cage is very stiff, this may lead to fracture, and this is not only it is painful to the patient, but it also makes the whole process inefficient. Similarly, if you are pressing the chest on the very lower side towards abdominal, you may damage the abdominal organs, and that may lead to rupture of liver, spleen, and other vital organs. And then, if you are pressing the sternum or this breastbone on the very higher side and very hard and in very forceful manner, you may also damage the some important large blood vessels which are in vicinity of the your heart, and this may lead to unwanted and very painful complications, and you are making procedures more difficult and complicated rather than making a beneficial to the patients.
Right. Dr. Pathak, what if a person is having a cardiac arrest, has an ICD or a pacemaker implant? Can one still perform CPR on such patients?
Yeah, definitely. Nowadays we see more and more lot of patients who have been implanted with either a pacemaker or an ICD. What is important to note is that the pacemaker, the implantation procedure or the placement of these devices is basically in the upper part of your chest, just below your collarbone, usually on the left side for pacemakers and on the right side for ICDs. We can conclude that the CPR that we are performing is in the mid part of chest. So performing a CPR in a patient who has a pacemaker or an ICD implant does not hinder with the pacemaker function. Only in some cases, if the pacemaker or the device has been implanted just recently, you may cause the lead of the device to dislodge from its normal position, but that is a secondary issue, because first and foremost thing to do is to revive the patient, and if the lead has been dislodged during the procedure, then it can be taken care of later on. So definitely all the patients who are having a pacemaker or an ICD implant should undergo CPR if needed.
Right. That's interesting. Dr. Tyagi, does a heart attack always feel like sharp chest pain? What are the kind of symptoms that people really need to be aware of?
The symptoms of the chest, this heart attack, is typically the retroesternal chest pain with sweating and going into the left arm and up to the jaw. But these typical symptoms occur only 20 to 25% of the cases. In rest of the cases, it can occur in between the jaw and up to the umbilical region. This whole area is representing the heart supply area. So any discomfort representing this area, and if the patient developing some uncomfortable or some sweating, then you should assess the cardiac point of view. The discomfort that can feel like uncomfortable pressure, squeezing or fullness or pain, that represent the heart attack. But particularly in the elderly patients and in the females, they experience some other symptoms like shortness of breath or excessive sweating, nausea, vomiting, back pain, or even the shoulder pain that represent the heart attack. Other people may include this nausea, lightheadedness, and excessive sweating. So we can say that any symptoms which is unexplainable and representing this area in between the jaw and the umbilical, whether it is chest pain, whether it is shoulder pain with sweating, or the jaw pain or the neck pain or the epigastric pain, which is unexplainable associated with sweating, then we should go for the cardiac checkup and go for the electrocardiogram to rule out the event of the cardiac event like myocardial infarction or unstable angina. Thank you.
Right. So that, of course, is a description of what a heart attack essentially feels like. But Dr. Kishore, what are the treatment options for a heart attack?
So in heart attack, the dictum what we say is the time is muscles. Means we need to diagnose it at a very quickly, and we need to work very fast. So right at the first medical contact means anybody who is capable of giving the primary treatment, the treatment should begin in the form of basic antiplatelets, for example, aspirin and other supportive things like oxygen, just before reaching the hospitals. So as soon as patient reaches the hospital, which is capable of handling such emergencies, for example, if patient reach in a center which is not capable of doing cath procedures like angiography, then some blood thinners like streptokinase or some advanced blood thinners are being infused immediately to get rid of this thrombus which is present in the blood vessels of the heart. If patient reaches to the cath lab facilities, then the important aspect is to intervene as soon as possible, go for angiography and open up the vessels and remove the clot and put a stent or CBG, whatever suits best for the patients, and then manage accordingly. Thank you.
Right. Dr. Pathak, what then is the role of cardiac rehabilitation in improving cardiovascular outcomes?
Yeah, so again, something very important which is usually ignored, that patient as well as the doctors are basically focused. We are also the culprit because we are all focused on the treatment modalities as such, the medications and the interventions. But cardiac rehabilitation is also a very important aspect. It is basically an outpatient program where you get enrolled for exercise and in other treatment modalities like strength training, your lifestyle modifications, your dietary changes, your way of conducting yourself. Smoking cessation is very important part of it, and other aspects are there. So the exercise, the cardiac rehabilitation in a nutshell is the add-on program which is to be there in all the patients who have suffered a cardiac disease, and it will improve your exercise capacity, it will improve your quality of life, and in different studies it has also shown to improve on the patient's outcome, lesser chances of mortality or cardiac arrest, and lesser symptoms. So if properly managed, the cardiac rehabilitation is also a very important aspect of the treatment plan of the heart patients.
All right, very important points being made there by a panel of expert doctors. Thank you all very much for joining us on this edition of the show. That's all the time we have.